Okay, I want to show you how to do kinesiotape for the hip. This patient has, unfortunately, a need for surgery, but when we put kinesiotape on her, because her joint is bone to bone in her hip, and we've done pretty much everything that we can, but I think that there's only so much you can do barring a miracle, and even though I believe in that, sometimes the surgery is necessary. So I want to show you how to do kinesiotaping because in her situation, it actually helped for the days that the kinesiotape was on. I only use good kinesiotape. The original kinesiotape is Kinesiotape from Japan, and the best one is gold. So if you want to get the gold version kinesiotape, and it's called Kinesiotex Gold. Kinesiotex, spelled Kinesiotex, and you can get it on Amazon. But today I want to show you how to apply the tape. In her situation, there's 4 basic ways that you want to stretch the tape. All this is just stretchable tape. So you're actually doing a treatment as you keep it on your body. So what you want to do is in this situation, I wanted to cause lymphatic drainage and also increase space in the joint, and I also want to increase the strength of the muscle because sometimes it's just a weakness. So in this case, when you do the taping from here to here, you start it up here and you stretch it to here, and I gave it a pretty good stretch, and that's, you can experiment with that to see which one is the best results. I'm finding that sometimes if you stretch it more, you get a better result. If you stretch it not that much, but you start here, then it's more like for drainage, like lymphatic drainage. So in this case, I did it for muscle strengthening, but you can also get drainage. I did that for my ankle the other day because I sprained it going hiking, and I put a pretty strong stretch on there, and within a day, my ankle pain was from swollen and bruised and black. It was going to turn blue, I can tell, because of the sprain. I put on kinesiotape right away that night, and within a day, I was able to walk on it. And so the kinesiotape does a lot because in this case, it's going to drain the fluid going up. But by starting here, and you stretch it down this way, and apply it down here, it starts to pull the muscle up this way, and it drains the tissue up, or any inflammation, it drains it up. So I applied one from there to there, here, on the side of the leg, right from the hip joint, which is it's like the top of the hill right here. You're going to have to feel it's kind of a hard bone right there, versus soft. It kind of starts to soften up right there. That's you getting into the pelvic area. But once you start getting the hard bone right there, that's where you want to apply the tape. One this way along the hamstrings, and then one across this way. So here's how I did it. I generally have strips of 4 blocks and 4.5 blocks. I just use that most of the time. So to apply this, you tear again right here. You tear it right here, and you apply that down right on top. You pull it down, stretch it about 40%, and then put the remaining strip here. You peel that off, and you apply that last part down like that. I'll be right with you for a minute. And then I did the same thing for this tape right here in the back along the hamstring. And then the last strip is a little bit different. You take that and you tear it in the middle. You tear it and you kind of separate it with your fingers so that this part here is exposed, no tape, and just the adhesive. You stretch it. While you're stretching it as much as you can, you put it down. And then as you put it down, only the ends are not stretched. Peel off the ends and then do that last. And then rub it really good, okay? I always rub in the direction where you don't peel the edges, because once the edges peel, then they start coming off. So I like taking the corners off too as well. I cut the corners, and that helps to prevent it from getting caught by clothing when you're trying to put clothing on. And the last thing is you want to go ahead and you want to put the person. This is the hardest part, and you have to kind of be familiar with basically the way the joint moves. So if you're going to on this tape here. Now, if you don't do this, it may not be critical, but it's always more functional for the person. If you put a tight piece of tape on there, you want to put the leg in an extended position. So this tape here, I'm going to put it down like this, and you're going to stretch that leg out, and then you apply the tape. Same thing with the hamstring. You're going to bring the knee up this way, and then put it on. Okay? And then when it comes to this correction right here, you don't have to really do anything. You just have to leave the joint in a neutral position for the space correction. This one right here, that goes straight across, where you open it in the center, you stretch it like that, it pushes the tissue toward that way, toward the stretch, and it kind of groups the tissue up and allows more space in the joint. Okay, so if you go like this, you tear it in the middle, and the patient was confused. I'm re-explaining it to her. It will, if you stretch it and then put it down, you're stretching it like this and putting it down. Now the tissue, the tape will pull in this direction. That increases space in the joint. Okay, so that's good for someone that has, compressed joints or joints that are, bone to bone. So that's how you do kinesiotape for the hip. I'll see you next time.